So unlike the previous anti-diabetic drugs that have never shown any cardioprotective effects, actually some of them have shown harm, like sulfonylureas, these newer agents, particularly the GLP-1 agonist and the drugs called SGLT2 inhibitors, have shown dramatic improvement in cardiovascular outcome. They have shown that not only these drugs control the hemoglobin A1C, but independent of their effect on hemoglobin A1C, they reduce the combined endpoint of myocardial infarction, cardiovascular death, and heart failure. Especially the SGLT2 inhibitors are a class of drug that all three trials so far have shown substantial reduction in heart failure hospitalization, which overall drives the improvement in cardiovascular mortality as well. Now, the GLP-1 agonist drugs are the drugs that really improve insulin secretion and decrease glucagon release. And doing so, they control the diabetes. But in addition to that, they seem to have significant cardioprotective effect, particularly reducing the risk of myocardial infarction and stroke. And three trials have now shown consistently that these agents, GLP-1 agonists, semaglutide, liraglutide, they substantially reduce the risk of macrovascular events, which is a substantial finding in light of the fact that the previous studies that were used to control glucose tightly or more intensively never showed any benefit. This was largely due to the risk of hypoglycemia, but these drugs do not produce hypoglycemia, particularly SGLT2 inhibitors, because SGLT2 inhibitors only work when glucose levels are high by their very mechanism, because they work by preventing the reabsorption of glucose in proximal renal tubule. And by doing that, they produce osmotic diuretics, they reduce blood pressure, they also produce other hemodynamic changes that are thought to be very beneficial in patients with heart failure.